Markelle Fultz suffered a left knee injury in yesterday's game against Cleveland. He was unfortunately diagnosed with an ACL tear afterwards and will be out for the remainder of the season. For those who don't know me, my name is Sonam and I am a resident doctor specializing in sports and exercise medicine. Let's go over Markelle's injury in more detail. As always, if you enjoy learning about the anatomy of sporting injuries, please be sure to subscribe to my channel. For now, let's get started. So let's play it through, or I'm going to start by playing it through fully. And we'll see Markelle here is driving to the basket. And that's the fall that takes him out. Now, when an athlete falls down and grabs their knee, as a sports medicine doctor, the first thing we're worried about is an ACL tear. And the main reason is those tears take an athlete out for the season and are most definitely surgical, especially if the athlete wants to get back into playing. So here you're going to look at him front on. He's driving the basket, and you'll see that he plants his left leg. And as soon as he plants his left leg, he awkwardly lands on it. And the way that he plants it, the knee caves inward. I don't know if anyone has ever buckled their knee, but essentially his knee is caving towards the inside, or his midline of his body. And that puts your ACL at quite a lot of stretch and at risk to rupture. So this view actually gives us a better idea of how the injury happened. Now, as you can see here, while there was some contact before the injury as he was driving the net, his foot ends up here, his body is driving that way, and his knee collapses inwards, and that puts him at the forces that biomechanically will cause an ACL tear. We say very traditionally that an ACL tear is a classic plant and twist injury. Happens a lot in soccer players, in basketball players, and believe it or not, ultimate frisbee players. I kid you not. So it's really this inward collapsing of the knee that really makes me worried as a sports medicine physician. The other structures in this area that I'd be worried about are potentially a meniscus tear, and his MCL ligament. So you have a ligament on the inside and outside of your knees that prevent it from collapsing in and out. This one puts this ligament under stretch because you're essentially opening that side of that knee and predisposing it to rupturing. So that's something I would definitely want to assess as well on the sideline. Usually, unfortunately, these injuries are quite traumatic in that when you suffer an ACL tear, there's almost an immediate large swelling of the knee. So he would actually be quite difficult to assess. And just kind of given the mechanism of injury and how quick he went down, that is why they got him an MRI that night. In the world of sports, an ACL tear, unfortunately, is quite common, and most people know once an athlete suffers an ACL tear, it's a season-ending injury. Let's take a look at the anatomy here in a little bit more detail. So this is the right lower aspect of the bottom of the foot and lower leg. This here is your shin bone. This is the bone on the side called the fibula. And what we'll do is we'll zoom in here and we'll take a look at where this ACL lies. So I'm going to look at it top down. That's why you're seeing the feet there. These are your two menisci right here. And this here is your ACL, so your anterior cruciate ligament. So it actually goes from the lateral aspect of your femur, which is the bottom of your thigh bone, down to the actual medial or middle aspect of your tibial plateau, which is your shin bone. The ACL is responsible for providing stability to the knee. So think about this as your knee, which is a hinged joint. It prevents excessive rotational forces. Unfortunately, when you put the knee in too much of a rotational force, you can predispose yourself to an ACL tear and suffer from one, much like Fultz did. Now, there's a few other things that can be associated with an ACL tear. We call it the classic triad. And essentially, if you get an ACL tear, you're going to want to look for a medial meniscus tear because they're commonly associated, as well as an MCL tear. This MCL is that ligament I told you about when we reviewed the footage, when his knee was collapsing in, that I'd be worried for. So while they didn't comment on this in the news, I'd be wondering whether or not he suffered these associated injuries. Now, in terms of how these ACL tears are repaired, they have to be repaired by surgery, especially if someone like Fultz is looking at playing full-time once again. In terms of rehabilitation and surgery, you're looking at the 9 to 12 month timeline. I mean, in cases like Fultz where he's got access to multiple professionals, he may be able to really push himself and get back at the 9-month mark. But it's tough, and ACLs really do need to repair before you can put that level of force on your knee. So an ACL repair is an arthroscopic repair done by cameras into the knee. You have to use a graft to repair that ACL to create a new one. They can either come from your own body or from another specimen, such as a cadaver. There's 3 main places they take ACLs from, mainly the patellar tendon, which is this tendon down here. The second most common is the hamstring tendon, which are these 2 tendons down here, the semitendinosus and the gracilis. And the last is the quadriceps tendon. When it comes back to returning to sport, usually once you're cleared by the surgeon and your therapist, you're safe to go back. And unfortunately, your graft may never truly be as strong as your original ACL. And the risk of re-rupture is also correlated with the type of therapy you do and the level of strength you have around your knee. Now, many people ask whether or not an ACL brace actually provides additional benefit once you have the repair. Most of the research says no. Once you have a repaired ACL and you've rehabbed it, aside from elite downhill skiers, the brace shows no additional benefit. So what does this mean in terms of recovery? Markelle's out for the season. He will definitely be getting surgery, and he's going to have at least 6 to 12 months of rehabilitation down the road. The biggest thing that he's going to need to do is get over that mental hurdle of whether or not he can trust that graft. These grafts are strong, but sometimes athletes are scared of re-rupturing that same knee. So I have no doubt that he can do it. I wish him the best of recoveries, and hopefully we'll see him back next season. If you like this video, click on the like button. For now, that's all. See you next time.